Today about Meconium Aspiration Syndrome. What are the risk factors of Meconium Aspiration Syndrome? What are the causes of Meconium Aspiration Syndrome? Now let's talk about complications of Meconium Aspiration Syndrome. Hi, today about Meconium Aspiration Syndrome. Meconium Aspiration Syndrome is a serious condition that occurs when a newborn inhales a mixture of meconium, which is the first baby's poop, and amniotic fluid into the lungs around the time of delivery. This can cause breathing difficulties and other complications that I will talk about later. So meconium is typically passed in the womb in case of Meconium Aspiration Syndrome when fetus is stressed, often due to lack of oxygen, and meconium can then mix with amniotic fluid and the baby may inhale this mixture during the delivery process. What are the risk factors of Meconium Aspiration Syndrome? Number one, advanced maternal age. Older moms are more likely to have pregnancies complicated by conditions that can lead to fetal distress. Number two, chronic health issues that mom can encounter. Moms with chronic conditions like hypertension or diabetes or respiratory issues like asthma have a higher risk of experiencing complications that can lead to Meconium Aspiration Syndrome. Number three, inadequate prenatal care. So lack of regular prenatal checkups can result in undetected complications that increase the risk of Meconium Aspiration Syndrome. Number four, smoking and substance use. This can compromise fetal health and lead to conditions associated with Meconium Aspiration Syndrome. And finally, prolonged labor. Extended labor can increase the risk of fetal distress, leading to meconium passage. What are the causes of Meconium Aspiration Syndrome? Fetal distress, hypoxia. When the fetus experiences lack of oxygen, which is called hypoxia, it can lead to fetal distress, and this distress often triggers the fetus to pass meconium into the amniotic fluid. Acidosis, it's a condition where there is too much acid in the body fluids, often caused by, again, insufficient oxygen. This can stimulate the fetal intestines to expel meconium. Post-term pregnancy. So pregnancies extending beyond 40 weeks are more likely to have meconium-stained amniotic fluid, increasing risk of Meconium Aspiration Syndrome. The longer the pregnancy, the more likely it is for the fetus to pass meconium due to the maturing of the digestive system. Intrauterine growth restriction. Fetuses that grow poorly inside mom in the womb are at higher risk of stress and hypoxia, leading to meconium passage. And maternal conditions. I mentioned hypertension, so high blood pressure in the mother can reduce blood flow to the fetus, causing fetal distress. Maternal diabetes can complicate the pregnancy and lead to hypoxia of the baby as well. Placental insufficiencies, so conditions like placental abruption, where the placenta detaches from the uterus prematurely, or placental infarction, so tissue death in the placenta, can reduce oxygen delivery to the baby, causing stress and leading to passage of meconium as well. Umbilical cord complications. When the umbilical cord drops through the open cervix into the vagina ahead of the baby, it can become compressed, reducing oxygen supply to the baby. Something that is called nuchal cord. So when the umbilical cord is wrapped around the baby's neck, it can compromise oxygen delivery to baby as well. And maternal infections like chorioamnionitis, the infection of the fetal membranes, it can cause inflammation and stress to the fetus, leading to expulsion of meconium. What are the symptoms of Meconium Aspiration Syndrome? Meconium Aspiration Syndrome presents with a variety of symptoms that can vary in severity depending on the extent of the meconium inhalation and the degree of respiratory distress. So, symptoms. Number one, respiratory symptoms, respiratory distress, which is a rapid breathing, that it's called tachypnea. Newborns with Meconium Aspiration Syndrome often breathe faster than normal as they attempt to compensate for reduced oxygen intake. When they breathe, they make sound that we call grunting. The baby may make a grunting sound during exhalation, which is an effort to keep the air sacs open. Then they often have something that is called nasal flaring. Flaring of the nostrils is again a sign that the baby is working hard to breathe. Chest retractions, so visible sinking of the chest wall between ribs and under the ribs during breathing, indicating labored breathing. Wheezing, a whistling or rattling sound during breathing can occur if the airways are partially blocked by meconium. Cyanosis, so bluish skin color. Cyanosis, a bluish tint to the skin, lips, fingernails, indicates that the baby is not getting enough oxygen. Apnea, so periodic breathing pauses. Apnea refers to episodes, events when the baby stops breathing for a short period of time. This can be severe sign indicating significant respiratory compromise. Rales and crackles, so crackling sounds heard throughout the chest when we listen with stethoscope. These sounds indicate fluid or mucus in the airways. And other symptoms like low Apgar score. Apgar scores are used to quickly assess the health of the newborn at 1 and 5 minutes after birth, and babies with Meconium Aspiration Syndrome typically have low scores, particularly in the areas of respiration and color. Then lethargy, decreased activity. A baby with Meconium Aspiration Syndrome may appear unusually tired or weak, showing little interest in, for example, feeding or interacting. Those babies may have poor muscle tone, that it's called hypotonia. So again, those newborns, they have reduced muscle tone, appearing flappy or limp. Now let's talk about complications of Meconium Aspiration Syndrome. Complication of Meconium Aspiration Syndrome can range from immediate, life-threatening conditions like persistent pulmonary hypertension, PPHN, and pneumothorax, to even long-term issues such as chronic lung disease and developmental delays. So let's start with respiratory complications, and I mentioned persistent pulmonary hypertension of newborn, PPHN. PPHN occurs when the newborn's circulatory system doesn't adapt to breathing outside the womb, causing high blood pressure in lungs or arteries. So when the baby is inside mom, they are not using lungs. Everything is constricted, or vessels are constricted. When baby is born and takes first breath, those vessels in lungs are supposed to relax, open up. In case of PPHN, pulmonary hypertension, this doesn't happen. Those vessels in the lungs stay shut down, constricted. Symptoms of PPHN include severe respiratory distress, cyanosis, and low oxygen levels despite oxygen therapy, despite providing oxygen. Management, PPHN requires interventions such as inhaled nitric oxide, mechanical ventilation, or even something that is called ECMO to reduce pulmonary artery pressure and to improve oxygenation. Next complication, pneumothorax. Pneumothorax is a condition where air leaks into the space between the lung and the chest wall, causing lung collapse. So normally between the lung and chest cavity, there is not supposed to be any air. It's just a little bit of fluid there. In case of pneumothorax, if we would look at our lungs under microscope, our lungs look like grapes. Those air sacs look like grapes. And in case of pneumothorax, some of those grapes rupture. There is a hole in those air sacs, and air is escaping from the lungs and escaping to chest cavity and compresses lungs, causing its collapse. Symptoms of pneumothorax include sudden worsening of respiratory distress, asymmetric chest movement, and decreased breath sounds on the affected side. What do we do to manage it, to treat it? We have to insert a chest tube to remove, to chest cavity, to remove that air and allow lung to re-expand. The next complication of Meconium Aspiration Syndrome, pneumonia, so infection of the lung, which can occur due to aspiration of meconium contaminated amniotic fluid. Symptoms may include fever, increased respiratory rate, difficulty breathing, and general signs of illness. Pneumonia requires antibiotic therapy and supportive respiratory care, mechanical ventilation, and oxygen administration. Next complication, something that is called chemical pneumonitis. Inflammation of the lung tissue caused by chemical irritation of meconium causes chemical pneumonitis. Again, symptoms, respiratory distress, coughing, possible fever. Management, it's supportive care including, again, oxygen therapy, mechanical ventilation, and possibly corticosteroids to reduce that inflammation. Other complications from cardiovascular system, cardiac dysfunction. The heart may struggle to pump effectively due to high pressure in baby's lungs and the extra work required to oxygenate the body. Symptoms of cardiac dysfunction include poor perfusion, low blood pressure, and signs of heart failure. In order to treat it, to manage it, we have to give the baby medications to support heart function. We have to carefully monitor fluid management, and in severe cases, those babies need ECMO. Then neurological complications, hypoxic ischemic encephalopathy, HIE. HIE is a brain injury that is caused by lack of oxygen and blood flow to the brain. Symptoms include seizures, altered concussions, poor muscle tone, poor reflexes. Treatment for HIE, it's therapeutic hypothermia, so cooling baby's body to reduce brain damage. Sometimes those babies need anticonvulsants, medication for seizures, and supportive care. Then developmental delays because of lack of oxygen deprivation that can lead to delays in reaching developmental milestones. Those babies have delays in motor skills, for example, speech, cognitive development, and social interactions. In management, we can help those babies with early intervention programs, physical therapy, occupational therapy, and speech therapy. Then in regards to long-term respiratory issues, chronic lung disease, also known as bronchopulmonary dysplasia, BPD. BPD is a condition where the lungs remain underdeveloped or damaged. Symptoms of BPD, chronic respiratory symptoms such as wheezing, frequent respiratory infections, and reduced oxygen tolerance management, long-term respiratory support, including supplemental oxygens. Those babies often go home with home oxygen. Then sometimes those babies need medications to manage symptoms, and they need long-term follow-up with pediatric ophthalmologist. Also, long-term complication asthma, increased risk of developing asthma-like syndromes in childhood. Symptoms of asthma, wheezing, shortness of breath, increased sensitivity to respiratory irritants. Management of asthma includes medications such as albuterol, sometimes inhaled steroids, avoiding triggers, and regular monitoring, again by pediatric pulmonologist. Babies with Meconium Aspiration Syndrome are at increased risk of sepsis, which is a systemic infection that can occur if bacteria enters the bloodstream from the lungs. Symptoms of sepsis include fever, lethargy, poor feeding, and even signs of organ dysfunction. Management, prompt antibiotic therapy, and supportive care in neonatal ICU. Babies affected with Meconium Aspiration Syndrome have also gastrointestinal complications, feeding difficulties, because respiratory distress can interfere with newborn's ability to feed effectively. Those babies have so much problem with breathing that they cannot do suck, swallow, and breathe at the same time. They may have poor sucking, poor swallowing, leading to inadequate nutrition and growth. Management may require feeding via either nasogastric or orogastric tube, or administration of something that is called TPN, total parenteral nutrition, so IV nutrition, until the baby's respiratory status improves and the baby can feed orally. How do we evaluate babies with Meconium Aspiration Syndrome? Evaluation includes a combination of clinical evaluation, then laboratory tests, and imaging studies to confirm the presence of meconium in baby's lungs, baby's respiratory tract. It can also help us to assess the severity of the condition. So number one, we start with history and physical examination. So first, maternal history, review of maternal factors such as gestational age, is it a post-term pregnancy, then complications during the pregnancy, did mom have a history of hypertension, placental insufficiency, diabetes, then signs of fetal distress during labor are important. The presence of meconium-stained amniotic fluid around the time of delivery. Next, newborn examination. So assessment of the newborn respiratory status, including signs of respiratory distress. Is the baby tachypnic? Is the baby grunting? Is there nasal flaring or retractions if they are present? Does the baby show us any signs of cyanosis? How does the baby appear overall? Apgar score is important as well. So Apgar score is assigned at 1 and 5 minutes after birth, and we are evaluating heart rate, respiratory effort, muscle tone, reflex response, and color. Low scores, especially in respiratory effort and color, may direct us into diagnosis of Meconium Aspiration Syndrome. Then, what laboratory tests may be helpful? Arterial blood gas. This is a test that measures oxygen, so PaO2, and carbon dioxide, PaCO2 levels in the blood, as well as blood pH, so level of cyanosis. Newborns with Meconium Aspiration Syndrome often show low oxygen levels, which is called hypoxemia, and high carbon dioxide levels, which is called hypercapnia, indicating impaired gas exchange in the lungs. CBC may be helpful as well. CBC can help identify signs of infection or inflammation, such as elevated white blood cell count, which may accompany Meconium Aspiration Syndrome. Then another blood test, blood culture. This is a test performed to rule out or confirm the presence of bacterial infection that can complicate Meconium Aspiration Syndrome. And finally, important imaging studies, chest X-ray. A chest X-ray is crucial in diagnosis of Meconium Aspiration Syndrome. The chest X-ray may show a pattern of streaky or nodular opacities indicating meconium in baby's airways. It can also reveal some other characteristic findings, complications of meconium aspiration syndrome as patchy infiltrates or atelectasis. Those are areas of lung collapse. Hyperinflation or overexpansion of the lungs. Pneumothorax, which is an air leak into the chest cavity. Other additional diagnostic procedures, pulse oximetry, so continuous monitoring of blood oxygen levels helps us neonatal ICU staff to assess severity of hypoxemia and effectiveness of oxygen therapy. Then echocardiography. An echocardiogram can be used to evaluate for persistent pulmonary hypertension of newborn PPH and to assess also heart function and blood flow in the lungs. Finally, laryngoscopy and suctioning. If meconium aspiration is suspected in the immediately after birth, laryngoscopy can be performed to visualize and suction meconium from the airways before the first breath to prevent further inhalation. How do we treat babies with meconium aspiration syndrome? So first, as I just mentioned, immediate management after birth, suctioning. Immediate suctioning of the mouth and nose upon the baby's head delivery before first breath. It can help to prevent further aspiration of meconium. Then endotracheal suctioning when the newborn is not vigorous, when the newborn has poor muscle tone, inadequate breathing, heart rate is less than 100 per minute. The breathing tube, endotracheal tube, is inserted to baby's breathing pipe, first to help them to breathe and provide oxygen, support breathing, and then possibly suction meconium from the trachea. Then stabilization, so warmth and positioning, ensuring the baby is kept warm and in a proper position to maintain airway patency and facilitate breathing. Then after the baby is admitted to neonatal ICU, oxygen therapy. Supplemental oxygen can be administered through nasal cannula in those mild cases or face mask to maintain oxygen levels and reduce hypoxemia. In more severe cases, continuous positive airway pressure CPAP. It's used for milder to moderate cases to keep the first air sacs open and improve gas exchange. And finally, in those severe cases, ventilator support, mechanical ventilation. Those babies require mechanical ventilation, help from the ventilator to help them to breathe and ensure adequate oxygenation and carbon dioxide remover. And sometimes they need even special ventilator that is called high frequency oscillator. It's a special ventilator that breathes for the baby very fast, and those ventilators are used when conventional ventilator is not enough to provide those babies enough oxygen and eliminate carbon dioxide. And as mentioned in the beginning of my talk, ECMO, extracorporeal membrane oxygenation. This is used in extreme cases of respiratory failure. Excuse me. ECMO, it's a heart lung bypass machine that allows the lung to rest and heal, but by taking over their function of oxygenating in the blood. Only special centers, only high levels of neonatal ICU, they use ECMO. So very often babies need to be transferred to another hospital in order to be treated with ECMO therapy. Then medications that we use for meconium aspiration syndrome. Surfactant therapy. Surfactant, it's a substance in our lungs It's like a film, like a soap that it's coating lungs and keeps air sacs open. In case of meconium aspiration syndrome, when meconium enters lungs, it inactivates that soap, surfactant. So surfactant often needs to be given in babies that are admitted to neonatal ICU and required mechanical ventilation in order to improve lung compliance and gas exchange, especially in cases with significant lung inflammation or collapse. Then those babies often need antibiotics. Antibiotics are administered to prevent or treat bacterial infections, as meconium aspiration increases the risk of infection in the lung that it's called pneumonia. Then those babies, very often they need medications, sedatives, as well as muscle relaxants. Especially babies that are intubated, so they have breathing tube and they are ventilated with mechanical ventilation, conventional ventilators or oscillators. Those babies required sedatives and muscle relaxants to ensure they remain comfortable and to prevent them from fighting the ventilator. Monitoring and supportive care in neonatal ICU for babies with meconium aspiration syndrome. We have to often do some blood work, some tests on the regular basis. The first one is blood gas monitoring, so regular checks, frequent arterial blood gas analysis to monitor oxygenation, carbon dioxide levels, acid-base balance. It guides us in adjustments in respiratory support. It tells us if we are able to provide those babies enough support for the breathing and enough oxygen. Then, because those babies are not able to feed, they are not able to suck, they are not able to feed orally, intravenous nutrition is important, ensuring adequate hydration and electrolyte balance, especially if the baby is critically ill and unable again to feed orally. Total parenteral nutrition if newborn cannot tolerate enteral feeding. Parenteral nutrition, some sugar, lipids, protein, microelements, vitamins that are provided to the baby's bloodstream to provide them enough calories and nutrients. Then temperature control, keeping the baby in the thermoneutral environment to prevent hypothermia or hyperthermia, both of which can exacerbate respiratory distress. Then inhaled nitric oxide. Nitric oxide, it's a gas that is provided through the breathing tube, through the mechanical ventilation, either conventional ventilator or oscillator. It's mixed with oxygen and it's used to relax pulmonary vessels and reduce pulmonary hypertension. Then medication sometimes are used, such as sildenafil or milrinone, to manage pulmonary hypertension and improve blood flow in the lungs. In case of pneumothorax, I think I mentioned that before, we have to insert chest tube to drain, to remove air from chest cavity because of lung collapse, and that chest tube, when we suck the air out, it causes lung re-expansion. Those air sacs can open again. That's how we manage pneumothorax. Then when we talk about prevention of meconium aspiration syndrome, preventing involves strategies to minimize the risk of meconium passage into the amniotic fluid and subsequent aspiration of meconium and amniotic fluid by the fetus. That involves a combination of good prenatal care, effective management of labor and delivery, and prompt skill interventions after birth. Key strategies include ensuring maternal health through regular prenatal visits and management of chronic conditions, monitoring fetal well-being during labor and delivery with continuous electronic fetal monitoring, Very important thing, timely induction of labor to avoid post-term pregnancies, including labor before 42 weeks of gestation. That can reduce the risk of meconium passage significantly, as the likelihood increases with gestational age. And then immediate and skilled management of the newborn's airway if meconium is present in amniotic fluid. These measures collectively aim to reduce the incidence of Meconium Aspiration Syndrome and improve outcomes for newborn at risk. What's the prognosis for newborns with Meconium Aspiration Syndrome? That can vary widely depending on severity of the condition, the timelines and effectiveness of treatment, and the presence of any complications. Generally, with prompt and appropriate medical care, many infants recover fully and lead healthy lives. However, the presence of severe complications, underlying health conditions, or delays in treatment can affect prognosis, requiring long-term medical and developmental follow-up. So early intervention and comprehensive care can significantly improve outcomes for those with more severe symptoms of the condition. That would be all in this talk about Meconium Aspiration Syndrome. For questions, comments, please contact me at neonatologyforparents.com. Thank you.